Miss Anthony, want to follow me? Oh, go on that bit there, man.
It's midday in Alder Hayes Casualty Department.
He's trapped his finger in the door and he's lost the tip of his little finger. And here it is, wrapped in some cling film, which is being held in ice. Can I have this hand, this one here? How are you? Right, I just need to whip this off, Mum, and have a little nose under here. It's a little one, isn't it?
It is.
Wow, look, have a look. Look at that.
He's been crying a lot.
I'm sure, yeah. Okay. Had any pain relief? No. Very common. Children forever leaving hands indoors, or when the wind blows.
My other son David got knocked over. He had 6 stitches inside his head and 11 outside. I just think I'm a terrible mother.
Is this Jennifer?
Yeah.
Right.
A toy telephone.
A toy telephone? Yeah. What number is it that's up your nose? Eh? Don't put your fingers up, we'll make it even worse. Let's have a little look at your nose then, shall we? Can I have a light? Pen torch will do nicely, thank you.
You can.
Okay, just show me where your little piece of telephone is. Will you tip your head back for me, sweetie? Shall we lay her down? There's a good girl. Oh yes, there it is. Easy to see.
Basically, what we're going to do is pop a dressing on that. So we'll keep that there. We'll be back in a few minutes. A little bit of finger here. There's a fingernail with a little bit of squashed skin attached and pulp. But we're not going to try and put that back on. It's a bit squashed and mangled anyway. But it's important that people do bring tips of bits in because sometimes you do want to try and put them back on.
Make your way along to X-ray. They'll take a picture of his finger and they'll give you the picture to bring back to us.
OK then, thanks very much.
See you in a bit.
Come on.
Your mummy's hand.
There's a good
Yeah,
girl.
you're clever girl. Nearly done. Oh, great. All done.
It says play on it.
There you go.
Look. Has that made tears come into your eyes, has it? Oh. There. I think I can sign that one to the bin, Mum.
Yeah.
Before we end up with any more bits up her nose. OK.
Thank you.
Oh.
Bye-bye, sweetheart.
I know your fingers come off. But you're going to make it better now. It grow back.
This one, isn't it? Yeah, that's it. Just at the tip. As you can see, the amputation, if you like, has just missed the first bony part of his finger, so he hasn't fractured this bone here. If he had, he would need a course of antibiotics.
It should heal up quite nicely. The nail will grow up, and that pulp the skin will sort of grow round it, and it should look fine, normal.
That's it, just keep those down, Mum, that's lovely. So, if it gets wet, you must bring him back to see us and we'll change everything.
Yeah.
Oh, I'm sorry, little fella.
It's all right, we'll make it better.
If your little fella develops a temperature or this becomes quite smelly, that would be a sure sign that the finger's become infected, okay?
Yeah.
And if it gets infected, then of course you need some antibiotics. Isn't that good, hey? Don't tell all your pals though, because they'll want one. That's it, finished.
Right, thank you. Thank you.
Bye-bye, little man.
Say bye-bye.
Well done, you were very good.
Bye.
Okay,
Thank you.
Bye-bye.
A newborn baby arrives from Liverpool Women's Hospital suffering from a rare and life-threatening condition. Alder Hayes intensive care and neonatal teams have the specialist skills to perform an operation on such a young baby. Faith Hampson was born with a diaphragmatic hernia. She has a hole in the wall of muscle below her lungs through which her intestines have been pushed. About 100 babies are born with this condition each year. If the hole isn't repaired, Faith will die. Faith is Tracy and Peter's first child together. Tracy has just left the maternity hospital. She hasn't been able to hold Faith since the birth.
Come on in.
I'm Caroline.
Faith's condition was discovered during a routine scan just before she was born.
Try to touch on all
Of course it is, yeah. Yeah, get little handies. Mum and Daddy. Don't worry about the beeps.
Just need to zero the transfer.
All right.
Funny having this transfer.
She's got big thighs, isn't she?
So how long should we in? For both?
Just take it day by day, really, at the moment. You know, obviously she's going to go to theatre tomorrow, and some babies will wean off a ventilator quite quickly, and others sort of like lie there and think, oh, this is marvellous having this machine breathe for me. So, you know, a lot of them will be quite sort of slow. But we'll just take it day by day. Anything, you know, like, you need to know anything, just ask and we'll always tell you.
Still, it's a bit nervy when you come in and you see all the tubes and wires everywhere. And when the beeps go off and you panic.
The intensive care team will have to stabilise Faith's breathing before the operation can go ahead. On Ward C2, 18-month-old Cameron Bennett is having further tests to check his brain responses. Since birth, Cameron has developed severe brain damage. Last week, neurosurgeon Paul May performed an operation to drain excess fluid from his head to prevent further damage. Although this immediate problem has been resolved, Cameron's long-term treatment is being reassessed. The care of such severely brain-damaged children requires difficult decisions to be made by the neurological consultants.
What we're trying to do is use the light from Cameron's side field of vision.
Today, Cameron's parents, Darren and Samantha, have come back to Alderhay to talk to the team about his future.
He's only really this week started to tolerate much being put into his hands, and has not really had very open hands until this week. Said it's so impressive, relaxing.
The neurological team is led by consultant Lewis Rosenblum.
So how is he?
Okay, not too bad.
And he's behaved over the weekend?
Yeah.
No fever?
Yes, he's actually got a bug in his secretions, and I'm just waiting for one of your team to come and write him up for something.
Does he recognise anybody?
No.
Does he recognise you?
He seems to notice some voices.
Voices, possibly. OK, let's sit down and let's just talk and see where we're at. It's going to sound cruel and horrible, what I've got to say, but I think I've got to make myself absolutely clear that although Cameron has improved tremendously over the last week, and no one's disputing that all the evidence we've got from all that Mr. May's treatment has done, from the way that Cameron has been, is that even at best there is very extensive brain damage. And the realities of that mean that no matter how successful Mr. May is, how successful we are at controlling the vomiting, how successful we are at treating the chest and so on, managing the tracheostomy, progress that Cameron makes is going to be very slow and very limited. He's going to be profoundly disabled and totally dependent at best. I'm sorry to frighten you, and I know I am now, but you've got to understand that we're still doing our best for Cameron. But, oh boy, it's not going to be easy. That's the real message that we want to get across this afternoon.
I don't know how much more I can really carry on with, to be honest. I knew all the score anyway, but just hearing it makes you... I just wish it wasn't all happening. It's just terrible. I'll probably be alright tomorrow. It's just shocking knowing all the complications and the risks involved. And to me, I think he's more or less like a cabbage. And to see him what he was, to see him what he is now, it's very hard. He looks like my own lad, but he doesn't act like my own lad, and it's heartbreaking, really.
What's Cameron doing?
Despite the bleak outlook, Cameron is now physically well enough to leave the hospital ward for the first time since his operation. Soon he may even be able to go home to live with his parents. It's 9 o'clock the next morning. In intensive care, Faith is now stable. Half the babies with her condition die within their first week. Faith is just over 2 days old. Her operation will go ahead.
There you go, first cuddle. You comfy? Yeah. Get yourself comfortable, don't worry. Alright.
What's going on to the wires?
They tested the heart and everything yesterday. Heart's perfect, and so like everything looks good. So just hope everything goes well in the operation today.
Hi. Hello.
Neonatal specialist Rick Turnock will perform Faith's operation.
She's looking very well. We'll be looking to move her to theatre in about an hour or so, and we'll be doing the operation through a cut just underneath the rib cage. We actually do it through the tummy, sort of working upwards rather than through the chest working downwards. And the reason for that is that it's easy to get the bowel out from the chest that way. The other thing is that if it is as I think, her appendix will end up in the wrong place, and so we will probably take her appendix out at the same time. Okay, so the two for the price of one, as it were. It's been very reassuring that she's been so stable, really, over the 36 hours or so since she's been born, and that is good news. If you look at babies overall with diaphragmatic hernia, you know, there still remains this 50% sort of survival risk. But the fact that we've got this far and things are stable is encouraging from that point of view. But I always say, and it's something that we must stick to, is that particularly in the first sort of 2 or 3 days after operation, it's really each hour as it comes, you know, because things can change. So the message would be highly encouraged, but still, you know, when we really do have to keep very close eye on things, and, you know, there may well be ups and downs.
Do you have to sign anything?
Yes, what I'd like you to do is to read that through. What I've written there is repair left diaphragmatic hernia and appendicectomy. And then that's my signature. Just have to read through, and then you just need to sign and block print your name on the bottom.
You're doing the operation yourself?
Well, yeah. It'll be me, or I'll be sitting taking my registrar through the case. We have to train them, but you can rest assured that difficult bits I do, and I show him how to do other bits. It's a standard way of doing things, nothing to worry about. Okay, we'll see you afterwards. Yeah, thanks. Cheers. Okay, that's good.
Okay.
Bye now.
Right, give her a nice little kiss as we go up. There we go. And Dad? There we go. This is the worst bit though, isn't it? The waiting and...
Down in the radiology department, 10-year-old Stephen Stewart is about to have his 7th operation at Alderhay.
Yeah, I'll take your picture today.
Stephen was born with brittle bone disease, which means the slightest knock can cause a fracture. He's had over 50 since birth.
Will you have this magic picture taken? Oh. I bet you've had this done a lot of times, haven't you?
Over the last few years, the team has inserted metal rods to strengthen Stephen's limbs.
Any noise coming? There we go.
So can you tell me why you're having this operation? Why you wanted it?
Well, we will when I start standing.
You want to start standing?
He was in paying money for years, always breaking something for years and years. And since, like, Dr. Walsh has started, they waited till he got a bit older and Dr. Walsh started doing things. That's all, well, touch wood, everything's gone well now.
Because do you get fed up of being in your wheelchair all the time?
Yeah.
Do you? Yeah, it'd be lovely if you could walk, wouldn't it? Never thought I'd see the day that Stephen would be standing. Yeah.
Each operation he's benefited from it. You know, with stop breaks and he can move his legs a lot more and you know, in the street, and so I think he thinks because he's benefiting, that's why he wants to go ahead with them.
Hi, Stephen. Hi, how are you?
Today, surgeon John Walsh plans to straighten Stephen's club foot so he can try to walk for the first time.
Right, so you've been on holiday, got nice and brown. Can you shuffle down the bed for me, Stephen? Lie down for a second. There's a good boy. Well done. Great. Lie flat. Great. So these are nice and straight now. Basically, this tissue here that's tight at the back of your heel, I'm going to straighten that and lengthen it so we can actually pull your foot round, and then we'll put you into a plaster till the thing heals. Okay?
Yeah.
Stephen's operation may take up to 2 hours.
Okay?
Yeah.
In intensive care, Faith is due to be called to theatre in 1 hour.
This is always the worst time, and you're high with emotions as well, aren't you? She's quite laid back about it all down there, isn't she? I know.
Are you ready to take her? Are you ready to take her?
I'll go check, actually.
Stephen is John Walsh's first case in theatre this afternoon.
See the butterflies on the ceiling here?
Right then, Stephen, could you lie onto this side for me and just show me how you're comfortable?
The team needs to know the exact position Stephen lies in naturally in case they have to move him during the operation. His bones are so brittle, any incorrect movement could break his neck.
Comfortable like that. Right, get onto your back again. Right, you're going to be drifting off to sleep right now. How are you doing there? Are you getting nice and sleepy?
Okay, Mum, that's it.
Actually, give me a big kiss. And going back to it's going to be at least a couple of hours, I think, Mum. Probably 2.5. Just very gently.
You can see at birth he had several fractures, one in either humeri and both femurs were fractured.
John Walsh runs through the operation with trainee surgeon Nikhil Pradhan.
So the plan is to gain some length in the foot and in the ankle by releasing the tissue at the back here, and I'll have to do something in the bones of the foot to try and realign it, and basically give him a foot that he can get into a shoe and bear some weight through. Ideally, I'd like him to be face down so it gets to the back of the ankle joint, but because of the risk with his neck, there's osteogenesis.
In the first part of the operation, John Walsh will lengthen the muscle before repositioning the bone.
He's not very much.
No. The original deformity of the foot would have been caused by fractures that occurred in the foot before Stephen was born, and so they were healed by the time he was delivered. Consequently, they had a persistent deformity. This Achilles tendon. Making a decision along the middle of it.
In intensive care, the team is ready to transfer Faith to theatre. The operation will last for more than 3 hours.
We don't want to walk around with us as well, if that's okay.
No.
All right. Walking up with us?
Right, yeah. Somebody's better steer this and somebody's better drive this.
You drive that.
Right.
You want to drive that?
Yeah, drive that.
See, I've moved furniture before.
Okay.
switched off at the moment. We're all along about the centre. All right. Come on. Will be all right. Okay.
Along the corridor, Stephen's operation is almost over.
We need to get into the
His ankle will be held in its new position with a staple.
But the bone is so soft that the stapler put in to hold it, I put it back with my fingers. Normally you'd have to use a punch to put it in, but I just pushed it with my fingers, it's so soft. One great thing about operating these kids is their bones always heal. The bones will join very, very well. You can see that his foot is in a much better position, and he should be able to get a decent shoe on that foot and hopefully be able to start putting his weight through it. He's been hinting that he wants his forearms doing next. I'm not so sure about, but we'll have to think about it once he's got over this.
Next door, Rick Turnock is preparing for Faith's operation.
Hello! Hiya. We'll have the pink super sensitive gloves, please. Special permission for these because they're more expensive. Julian, make sure we've got enough stools for us all to sit down. Are you sitting down?
Yeah.
He won't know how serious her condition is until he finds the hole in her diaphragm and assesses its size.
How are we doing, Jane? All right, Andrew? Oh, that looks good, doesn't it? Yeah, smashing. All right, Colin. Yeah. Not too close to the rib margin. We tend to be very careful about blood loss because, obviously, a baby of this... What does she weigh? About 3 kilos? Its total blood volume will be about 250 mils, which is what, about half a pint? Yeah. So if we lose more than 25 mils, which is 5 teaspoons of blood, then we're starting to run into problems with requiring blood transfusion, and we try to avoid blood transfusions. So it's something that you have to take care over this part, because if you start pulling and yanking at the valve, it's liable to rip. But it's just a very gentle teasing it out.
You do sort of operate on your head at this point, don't you? So around the corner.
But you're doing all right, that's fine.
The team slowly pulls the intestine from the lung cavity to reveal the deformity.
You work the spleen's well away from your side. Oh, it's a small defect. That's fine. The hole's probably about the size of a 10-pence piece. We leave the bowel out of the abdomen. It makes life a lot easier. That's lovely. Mr. Keshtigar, it might be easier from this side.
Is it?
Yes, I suspect so, because you know.
I can see it.
Right, all right, fine. Yeah, that's fine.
I don't want to delay.
Just get on with it, Ali. We have a lot of visitors from overseas who come to watch what we do. We like to think we get more than another children's hospital whose name we never mention within these walls, do we, Jane? Come on, Ali.
Oh. Just Mum wants to know how the baby's going on and roughly how long.
Half an hour.
Half an hour then. All right. Okay, I'll pass that on.
That's good. That's good. That's good. That's good.
Everything's going smashing. Mr. Turnock said that the hole was very tiny and everything's gone absolutely smashing. So about half an hour. Please. I know. I expected 3 o'clock. All right. I know. All right. She's doing well, isn't she? Right. That's why you called her Faith, wasn't it? Eh? Yeah. Faith.
So yeah, so the 2 operations for the price of 1. And there's the appendix. It looks like a sort of little worm. I'll hold it up and you can actually see how it's quite long, really. Anyway, we sort of turn it inside out. And what happens is, because we've actually completely denuded the appendix of its blood supply, it shrivels up inside the bowel. That's the theory, anyway. And there she goes. Right. So we're on the last lap now. Colin's just about to close up, actually. Colin is at the point where he will be just about to go solo on one of these. He's done 2 or 3, supervised, but done them really by himself. He's progressing well. And then the next stage is to go solo, but with the consultant feet up, you know, reading the Independent in the coffee room. Or the Telegraph for some of my more conservative colleagues. Suturing up. Everything's gone very nicely. Finished. That's great. That's great. Thank you very much. Lovely. Smashing. Thanks, Andrew. Jane. Good. We'll let Andrew get on with things now. Get the baby ready to go back to intensive care. Gonna have a cup of coffee.
5 hours after his operation, Stephen Stewart is awake.
How are you? Still a bit sleepy? Is your foot sore? Is it? You've got to have it up. You don't like it being up. Well, can I have a peep at it?
Puffy, isn't it? It's a bit
Oh, it's a bit swollen, isn't it? Okay. Well, it's important to keep it up because that keeps the swelling down. You can see your toes are nice and straight now. Remember they were over here before? So that's better, isn't it? I had to do the cut at the back here and lengthen some of the tendons. And then I've done another cut on the outside here and straightened the bones. And what it's done, it's brought your foot into a good position. All right? You're a brave lad. Always got a smile on his face, even when he's in pain. So everything went well. And we need to get an x-ray done tomorrow and make sure everything looks okay. I put one staple in just to hold things in position, just a metal staple.
So it won't need any more, that's it?
Not at this stage now. I mean, it looked very good, and it's certainly in a position where we'd be able to get him into a decent splint in the shoe, which is what we wanted, really. Yeah. All being well, probably get you home before the weekend. So far, so good. All right?
In intensive care, Tracy and Peter can see Faith for the first time since her operation.
Quick peek and then we'll wash him in. Blondie. Oh, ready?
You haven't seen her hair before?
Ready.
It's like blonde.
Oh, yeah, it's not red anyway. Yeah. Try to touch her head, yeah?
Yes, of course you can.
You haven't seen her ears before, have you?
Yes, I can.
Yeah, because I would have had her like wrapped up really, yeah.
Yeah. She's got loads of hair.
I don't think she had any. I don't know how you cope with this, you know.
Sometimes it can be quite difficult for the nurses as well as, you know, sort of mums and dads. And sometimes your own social background or anything like that can influence you. Like, say somebody like myself who's been trying to have a baby for about sort of 14 years and I've had sort of quite a few attempts at IVF. And then I did get pregnant in the summer and then had a miscarriage. So I've never, you know, sort of got angry that anybody else has ever had children and I haven't. Yeah, you know, I just think, well, it's a miracle that every child is born and maybe one day mine will happen. So she's doing absolutely wonderfully. We're really pleased with her condition. It's just a case now of letting her rest, keeping her like out of pain, so still on the same morphine that we were on before. Yeah. But it's still early days yet at the moment, and as I said, you know, we have to take day by day, and we'll see how she goes on tomorrow.
The operation has been a success, but Faith's life is still in danger until she recovers from the stress of the surgery.